Hello, everybody. Welcome to my poster. My name is Adam Shahar. I'm a Meccan student. I hold an MPH from the UCLA School of Public Health. Dr. Kristen Choi was my professor and has guided me throughout this project. A little bit of background about this literature review. The first thing you might be thinking is, why middle-aged men? Why interventions with middle-aged men, first of all? Well, middle age is characterized by a period of stressful life challenges, changes in family structure, changes in careers such as retirement. Now, why men? Men, if you look at their top killers of men, it's heart disease, and we also see suicide in middle-aged men is pretty high as well. Not only that, is that we see that men, as they get older, have fewer social relationships. So they are particularly at risk for loneliness. And loneliness is a strong predictor of poor physical and mental health outcomes. It's associated with chronic conditions such as hypertension and a range of cardiac diseases, mental health such as depression. So basically, I wanted to see, okay, what sort of interventions are out there that can reduce loneliness in men? And one of those interventions that was cited was mindfulness. And I think this is a very interesting type of intervention because it doesn't require many resources. So for the search, I looked at 3 databases. There really wasn't any study that particularly target middle-aged men. So they were just a part of the populations in the studies I found. These studies also needed to have loneliness as an outcome. And so here in the center graph, you can see the results of that literature search. And what is shown here is the effect sizes of the various interventions that were found. You can see the higher the bar, the greater effect the mindfulness intervention had on reducing loneliness. So you can see that the first bar, group mindfulness-based stress reduction, had the greatest effect. It had a significant effect on reducing loneliness. And you might be thinking, well, that is probably because of that group component, right? In this intervention, people would come together to do the workshops. But we can also see in these individual technology-based mindfulness programs in the lighter blue bars also showed an effect in reducing loneliness, which suggests that mindfulness interventions and perceptions of loneliness can happen independent of being in that group setting. Loneliness is, in fact, a subjective perception. You don't need to actually have physical proximity with people to reduce loneliness. And what was found in all of these articles was that mindfulness interventions were successful at reducing perceptions of loneliness. They were also associated with fewer depressive symptoms and reduced inflammation biomarkers, which are those biomarkers that are associated with cardiac related diseases. That 5th article that did not have an intervention looked at mindfulness dispositions. And those with dispositions that were more mindful experienced reduced levels of loneliness in high stress situations. And this study was particularly looking at firefighters. So what are the mechanisms that are hypothesized to reduce loneliness through mindfulness? Well, one is that when you are present to the moment, this kind of modulates your stress response and lowers that stress response. The second hypothesis is that not interpreting things that are happening and having a non-judgmental attitude towards the present moment helps regulate emotions. That helps you maintain a positive affect and really allows you to be with people in the moment and better your social interactions. So how can nurses harness this to really better outcomes for their patients? Well, we work as nurses. We work with patients for 12-hour shifts, and if we were trained in how to administer mindfulness interventions, then we can help those particularly susceptible, like middle-aged men. We can help them, guide them through mindfulness, and reduce those feelings of loneliness that are really at a height when people are, physically disabled and in a hospital and feeling like they can't do what they used to do. So if we guide them through these mindfulness interventions, then we can potentially contribute to increasing their positive affect and reduce inflammation biomarkers. So I would really like to acknowledge the support I've received from Dr. Kristen Choi, who was my past professor. Again, thank you so much. If you have any questions about this, feel free to email me. Email is right there at the bottom. I'll feel free to send you the list of references that I used for this abstract. Thank you.